If you've treated vaginal itching and it keeps coming back, here's what you're missing. A lot of women take medication, feel better for a few days, and then the itching comes back. I totally understand how frustrating that can be, especially after taking medications for days and even using suppositories and many other things, and the itching still keeps coming back. Hi, guys, welcome back to this channel. I'm Dr. Asiya, and as usual, we are going to be breaking down common health issues. Today's topic is why vaginal itching keeps coming back. Not every vaginal itching is a yeast infection. Sometimes it can be due to irritants like scented soaps that are used to wash the vagina. Remember, vagina is a self-cleansing organ. It does not need any external washing to be done. Sometimes it could be bacterial vaginosis and not yeast infection. There are also some sexually transmitted infections that can cause vaginal itching. I know you are wondering what is bacterial vaginosis that I just mentioned. Bacterial vaginosis is when the normal balance between the good and the harmful bacteria has been disrupted. This causes an imbalance of the vaginal pH and then encouraging harmful bacteria to overgrow more than the good bacteria. A normal vaginal pH should be between 3.8 to 4.5. Anything higher than this is suggesting an infection. The vaginal pH is naturally acidic, and this acidic environment is what helps regulate the good bacteria and the harmful bacteria. But when this pH is high, the harmful bacteria would overgrow and take over, and the good bacteria will be diminished. Bacterial vaginosis presents as a thin whitish discharge or yellowish discharge that is fishy smelling. They can also be associated with vaginal itching. Sometimes you might experience a burning sensation when you want to pee. Now, the sexually transmitted infections that can cause vaginal itching is number one, Trichomonas vaginalis, caused by trichomoniasis. Other ones are gonorrhea and chlamydia, which is why you need to do regular sexually transmitted screening for both you and your partner. Another reason why this itching might be coming back is that some people stop the medications that are prescribed by their physician after taking it for a few days because they feel better. But that doesn't mean that the infection is completely gone. Not completing the exact dose will not completely eradicate the bacteria or the fungi that's causing the infection. So, completing your medications is a way to prevent reoccurrence. The third one is after figuring out what the cause is and you're undergoing treatment, whereas your sexual partner is not undergoing treatment, this could be the reason why it's also reoccurring because your sexual partner could be transmitting the infection to you again and again. There are also certain habits that can affect this. Using scented detergents or scented products to wash your underwears can disrupt the normal pH of the vagina. Also, wearing tight underwears with heat being trapped there can also cause vaginal itching. This is why I always advise women that when you're at home, you do not need to wear panties except you're on your period. You can just wear a short in the house and allow the place to breathe. Also, I can't overemphasize on hygiene. Poor hygiene is the number one factor for reoccurrence of this. Last but not least, stop self medicating. Stop self medicating. I'm saying this again because most times people just go to pharmacies and get drugs over the counters, not knowing what the drug is being used for. For example, if the actual cause of the itching is a yeast infection is caused by a fungi called Candida, which is meant to be treated with antifungal medications. But if you go to the pharmacy and you get antibiotics are for bacteria. So you are not treating the exact cause, you are just loading yourself with antibiotics and you are not hitting the nail on the head. Now, overuse of antibiotics can make you to have what we call methicillin resistant infections, whereby you do a test and you have a result that looks like this. This is because you've abused antibiotics, and at this point, a lot of antibiotics might no longer work for you when necessary. One more thing you need to be aware of is There are a group of antibiotics that actually, when taken, they can disrupt the normal flora of the vagina. Example of this is levofloxacin or ovofloxacin, which is why your gynecologist or your health physician would actually prescribe it together with an antifungi just to prevent the disruption of the normal flora so that you do not have yeast infection. But if you don't know this and you just walk into the pharmacy and get these antibiotics, you end up wondering, why are you having this cottage cheese discharge? And you're wondering, is the drug even working? Please do not self medicate. So, if this itching keeps happening, please get properly assessed by your gynecologist to figure out why it's happening and also treat the cause. Maintain proper hygiene. If you enjoyed today's session, do not forget to subscribe, like, and share. And you can also follow us on other social media platforms. On Instagram, it's siya_series, and on TikTok, it's Scrub and Stories. See you in my next video. Bye.